Good evening, everyone. We are so glad that you're tuning in to this live about health and wellness for new moms. I'm super excited to be moderating this session today. I am Kinshuk from Team Clay. I know you have read through the topic, but just to let you know, this is our very humble attempt to break down the importance of health and wellness for new moms. Acknowledging the importance of a mother's health, this International Women's Day, which we will be celebrating on 14th of May, we are bringing this session to you, and I promise you that this session is going to be packed with information and interesting point of views that are coming from experts and experts in their fields who are doing some tremendous work with respect to mental health, physical health, nutrition, and more for moms and children. So, a healthy mother is one who can raise a happy baby. This is a strong belief that we maintain at Clay, and this is what we want to impress upon you today. I am so delighted to introduce our experts. We have Dr. Pooja Singhania, who is the consultant nutritionist at Clay, and she is the founder of Nourish 1000 Days. We also have with us Miss Vasundhara Kaul, who is the founding partner of Carpediem Psych Consultancy. Dr. Medha Singh, who is a practicing doctor at Tan Tock Singh Hospital, Singapore. My heartiest welcome to all of you. So glad to have you here.
Thank you so much, Kinshuk, for having us. And I'm extremely excited that we have a session finally dedicated for mothers. Looking forward to have a great discussion with the panelists.
Pleasure to be here, Kinshuk. Thanks for having all of us, and it'll be great connecting with all mums and sharing some insights.
Thank you so much and welcome everyone to the session. I'm really looking forward to some interesting conversation.
I feel our audience is also equally geared up to listen to all of you. The postpartum period for a mother can be a challenging time, both physically and emotionally. However, taking care of their health is of utmost importance because not only is this important for themselves but also for the health of their babies. So in today's webinar, we will be discussing the physical and emotional changes that a mother experiences, the importance of nutrition and exercise for new mothers, and the impact a mother's mental health has on her baby. We will also discuss strategies for improving the health of new mothers. So I believe motherhood is a bliss, but it comes with a set of transitions that are very new to any new mom. And the postpartum period can be very overwhelming for few because of course, physical and mental changes that a mother is going through. In addition to this, a mother also realizes the importance of balancing her own needs with the needs of her baby. So, the needs of a mother and a child are also not the same throughout the motherhood journey. I believe it changes a lot through the periods of 0 to 3 months, 3 to 6 months, 6 to 12 months. It is very different at each stage. So, I request all of our experts today to help us understand this transition from their own field of expertise. Let's begin with you, Dr. Medha.
Sure. Thank you, Kinshuk. A very warm welcome to all the mums who have joined this session today. And, before saying anything else, I would like to congratulate you on your motherhood. This is probably the most coveted crown that you are wearing, and you shall proudly carry it through the rest of your life. Okay. So, just like we all have heard many a times at many points in time that pregnancy is a physiological or a natural process. So, in the same way, post pregnancy transitions that the body undergoes or that you perceive physically, mentally, or emotionally are probably also, to be looked upon as physiological changes that you're going through rather than it being a disease condition. So, our job as new moms is probably to adapt to these changes, but one can adapt to these changes well only if one has a insight and an understanding into these issues. So, when you first deliver a baby, your body undergoes a lot of changes, most of which are, hormonal changes. And because of which you may see some physical changes within your body, mental changes, as well as emotional changes. So, but it is a transition phase, and your body has undergone a lot, and your external as well as internal environments have changed. Hence, there are many things, there are interplay of many things which have a physical, emotional, and mental basis that you are dealing with. So all coupled together probably looks like a mammoth path to take. But once there is a deeper understanding, probably the journey gets more manageable. And not to forget, this entire journey actually God created is meant to be a beautiful journey to be enjoyed, every bit of it, right? So, I think, I would just like to ask the audience here, what is the most vivid memory of your, initial motherhood days that stands out or that comes to your mind? Any visual memory or any other memory that comes to your mind when you had delivered your baby and when you had brought your new baby to home? So, why don't you all type in any of your thoughts on this or any memory that stands out in the chat box? It'll be interesting to know what stands out in your mind as of now. So, to me, I'm a mom as well. I'm a practicing doctor. I've been there, done it. So, when I think of my very early motherhood days, I probably recall a constant struggle between how to breastfeed the baby, the anxiety over the fact that I'm not being able to breastfeed properly despite it being told to us that it's a natural process, a wailing baby, not knowing why the baby is crying, and at the same time dealing with my own physical stresses. So you see, your body undergoes so many changes. I mean, especially because of the delivery, there are some bodily injuries also that you need to recover from. There is back pain probably. There is a lack of sleep. There is constant fatigue. There is this persistent vaginal discharge that we refer to as lochia. There are postpartum blues, not to mention. And then of course, there are other things, other specific medical conditions, like sometimes the gestational diabetes progresses onto a persistent diabetic state, uh, a hypertension problem. Sometimes there are questions about contraceptions. So all these are probably the questions that one is surrounded by during their early motherhood times. So I think the remedy lies or circles mainly around, your deeper understanding into these issues, as well as trying to understand when is the correct time to approach a trained doctor, and maintaining a good nutritional status, uh, commitment to your own self that you will breastfeed your child to the best of your abilities, and if possible, exclusive breastfeeding up to 6 months. And also, contraception. It is important to understand that while you have just delivered the baby, even during this phase, even when your menstrual cycles have not resumed, pregnancies can happen. So barrier methods of contraception actually are recommended during these stages. Now, when once you progress on with your motherhood journey and your baby is achieving some landmarks, especially after 3 months of age, that is the time when your rhythm with your baby establishes a bit better, and you're more in charge of the whole situation. But again, during this time, one must remember that you're still breastfeeding. While you can exercise, it has to be a graded, trained kind of exercise under the advice of a trained person, if possible, with good balanced nutrition, okay, and adequate sleep whenever or however suits your routine, as well as again taking care of bodily aspects like backache, all these things. So this is all about probably the 3 to 6 months period. And after 6 months, your baby is a bit bigger, more interactive, needs you intellectually, apart from the main, basic needs for sustaining life. So you're enjoying the baby more at this time, but at the same time you're dealing with the pressure of probably going back to work, or involving more of yourself into the household chores. So all these challenges are there to deal with. Also for working moms especially, you might want to prepare in advance so that you can make a decision whether it is feasible to continue the best breastfeeding to the best of your abilities along with your work, whether you would like to express breast milk. Those kind of things you're probably dealing with from there on. And of course I would say that the motherhood journey, uh, it has its challenges all along the way. If you ask a teenage mom what are the struggles they face, or what are the transitions they go through, they will also have lots to say. So it is a beautiful journey, but it needs a deep understanding. And I will probably hand over the time to our colleagues now to hear from them on this topic. Thank you so much.
Great insights, Dr. Medha. I think very true that while the journey is very enriching and it's a completely new turn to the life that the mother had been leading earlier, but then, yeah, there's a lot to learn, and it's like on job training for a mom. But talking about that, Dr. Pooja, I would like to know from you. From the nutrition perspective, how does the nutrition of a mother impact the baby, and what are the things that a mother should do, to take care of the baby well? Yeah. So
Sure. Yes. So Dr. Medha has sort of put the right, set the stage for it, that by saying that you consider uh, the entire changes through pregnancy and postpartum as being a physiological thing and not a disease condition. So one has to always remember that when you're approaching the diet and lifestyle, you have to think of it that okay, it's a phase of my life cycle which I'm going through, so it's not to be treated in a way that you bring in too many restrictions for a mother, but at the same time you are understanding that the body has gone through a big change in terms of the physiology, which includes hormones, and then which are going to impact your sleep and mood and your activity. So keeping all of that in mind, we are just being more conscious and careful during this phase about our nutrition, because we just want to come out of this phase as being the same as we were in the pre-pregnancy state. So it's like you are going through this transition so smoothly that you don't see any after effects of it later on. So that will be the way we, so it's just like, if you undergo a surgery, how you want to recover so that you're back to where you were before surgery. So it's the same way now, that after this journey you want to come back to where you started. So keeping that in mind, I would say that um, one is of course that throughout the pregnancy anyways, the mother's body is preparing for the next phase, which is this breastfeeding journey as a new mother. So a lot of the preparation is made right from pregnancy. So that's something, again, we must understand that you are accumulating a lot of the fat stores so that you are able to feed the baby well, and all of that is going to be utilized now. So keeping that in mind, your nutrition now will again focus a lot on things such as hydration, which is very very important for a new mother, because breast milk itself is 88% water. So the mother has to be really well hydrated so that she can produce that quantity of breast milk, which will have that hydration quality. Second thing we might look at is ensuring that the mother is having easy to digest foods, because we look at it as a post surgery kind of a situation. So then you want foods which are easy to digest light on the stomach. So that's what we focus upon. Then we would really look at certain specific nutrients, creating a balance of nutrients. So how we look at post recovery, protein requirements are high, iron requirements are high. Also, I would like to bring it, highlight that vitamin D requirements are high at this time, and one has to ensure that a new mother is taking care of her vitamin D status, because that has a very huge impact on her breast milk. So that, then I would say that you could look at rest as being one of the important aspects here. So although it's not exactly nutrition, but rest and sleep is what really aids a mother's overall well-being, and therefore helps her to care better for her child. Then we can even look at some nutrients which help in the regulation of mood of a new mother, because as rightly put, this mother might be going through some mood swings, and with the hormonal changes, you can still look at nutrients in the diet, such as omega-3 fatty acids, such as vitamin E, which are going to help the new mother to cope with all the mood changes. Having said that, I just would like to sort of summarize it, saying that we don't go into too many restrictions for a new mother, because like I said, it's not a disease, it's a physiological change. So don't bring in all the myths related to certain foods which should not be eaten, and bringing in the guilt for a mother that if you are eating this, it might cause gas for the baby, or if you're eating a certain spicy food, it's going to really cause pain for the baby. So those myths should be kept away, because already a mother has a lot to deal with, and then all of this advice is going to overwhelm her even more. But again, while you can eat anything and everything, what you also need to be conscious about is there is someone who is completely dependent on you for their nutrition needs. So why not keep ourselves, our body, very clean and full of nutrients, because you are the source for someone. For 6 months, you're the only source of nutrition for a baby. So then you avoid junk food, you avoid oily foods, or you avoid outside food which might carry germs. So basically, you're trying to keep your body clean and nourished, and that is a responsibility as a mother you owe to this little child there, because here, while you're breastfeeding, they are dependent on you. And then of course, if they are breastfeeding well, it again ties in back to the mother's good health, where she feels happy, she feels very content and satisfied that yes, I'm doing the best for my baby. So that's something.
True, Dr. Pooja. I think in India and across the world, pregnancy and the postpartum period comes with a lot of advice from all around you, around the also around nutrition for sure, and the physiological changes that a mother goes through. But something that is less talked about is the change of roles, and what is the mother dealing with while switching these roles. Uh, of course, the life, as you said, that there is a complete human being who is dependent upon you for nutrition, that responsibility. And some mothers might be working mothers, they would have taken a break in their career postpartum. So all of this, I think, uh, takes a lot of mental bandwidth to deal with. So, Vasundhara, I would like to hear from you that what do you come across the how do mothers deal with these kind of transitions in their life?
Thank you so much, Kinshuk, and it was very interesting listening to both Dr. Medha and Dr. Pooja. Brings back a lot of memories from more than a decade ago when I became a mother for the first time. And of course, like you rightly pointed out, Kinshuk, I think we are a nation who is, full of advisors, and everyone knows what's best. So that's the first thing that I'm going to start off with. That as a mother, as a individual, you are responsible most definitely for another individual, and everyone's told you that you must do this and you must do that and you must live like this and you must sit like this and behave like this and do like this. Everything that you do is going to be like this. There's model available for your child. But what you must always remember is that unless you yourself, me Vasundhara, is fine, is taking care of myself, I will never be able to take care well enough of another individual. And that's where mental health and mental well-being, so to say, is so critically important. When I became a mother, I had everyone telling me about everything to do with my physical health, everything to do with what I should do, eat, drink, sleep, not sleep, etc. But I think the conversations, even at that time, were not around the fact that, how was I feeling? What were the emotions that I was going through? I was coming into motherhood after working for about a decade, and I had been a busy professional up until then. I was now responsible for another individual, not knowing whether I was wanting to go back to the same profession, carry it forward, do something else with my life. And I don't think anyone had the time, so to say, to have those conversations with me. And that's something that I do want to tell mothers today, that it is important for us to understand that just as the child is really, really important, we ourselves are equally important. And I like everyone in the audience to do a little experiment with me, to kind of draw home the point that why is it that emotions and how you feel is going to make you more functional. If you look after that, how does it make you more functional? So if all of you I'm going to show this up on the camera. Hopefully it's as clear as it can be. So if you put your thumb right in the middle and close the four fingers on top, try and move the thumb as fast as you can, right, without the four fingers moving at all, right? And if there's any superhuman being in this group of people that we are talking to today, I would really want to meet that person one day, because I don't think any of us are capable of doing that. So this really is the simplest brain and neuroscience model that there is, and the simplest way of understanding how the brain works and how our mental faculties work. Typically, again, we think that our brain is only thinking cognitively, is only doing the thinking part, but it has at its heart the amygdala, which is the emotional side of the brain. And the four fingers represent the prefrontal cortex right behind your forehead, which is the thinking and the functional part. If you don't take care of your emotions, you will not be functional. If you don't take care of how you feel, you can never be functional to 100% extent. So I'm sure you've had mothers like mine who've always told you that, oh, you are strong, you are a woman, you are an Indian woman, you must stand up and get going no matter what the adversity, right? And we've lived through that, and then we realize that there's a point that we all reach where it's not possible to maybe get up and get going. That point, when you reach that point, or you feel free to ask for help, accept help that comes from the family, accept help that comes from the friends. And when you do feel the need, and of course we might talk about it in a little while as well, where there could be a need for a professional as well, feel free to take that professional help, whether that professional help is required for a milder level of mental well-being condition, or a more severe, by which time you might need medication or a doctor. It's the same, right? Do all of you take medication, go to a doctor, take help when you are physically unfit? We all do, right? So why not take that professional help when another organ or another part of our body is not fully functional? So that's really and this is true even more when you are an early mother, because it's not just you yourself who, you're taking care of only yourself. You're also taking care of another individual. Whatever I've said, you will find that it is applicable to any part of your life, any adversity that you meet in life. But because the postpartum period is so critical and so important, you then therefore need to take care of yourself even more. And that's what I leave you off with, as far as the mental well-being concerns are concerned. I think Dr. Medha and Pooja have also told you the all important, that you do need to look after your physical health, you do need to rest, you need to get enough sleep. Of course, all of that is equally important. So when your baby sleeps, get a little sleep. I think that'll help all of us. Kinshuk, over to you.
Thank you so much, Vasundhara. I think this is a very holistic view for a new mom, all the inputs from all three of you. But I see a lot of questions coming up in our chat box. So we'll start with that. The first question here is about working moms. So somebody here asks, how do working moms manage feeding a new child? Is it okay to switch to formula when they step out? So I think Dr. Pooja, you would be the best person to speak about it. Can you help us out here?
Yes. Yes, of course, firstly, to all the working moms out there who at least even have the commitment to continue feeding, hats off to you, because it's not easy. But yes, as we all know, the Maternity Benefit Act is allowing us to stay 6 months completely with our child. But post that, as the baby is going to start some complementary food, as what we understand as starting their solids journey, we understand that that's why the mother is allowed to, or made to get back to work. But then we also need to understand that still the baby's 70% of their nutritional needs in the 6 to 12 months are going to be met by mother's milk, and 30% only are going to be met by complementary feeding. So we have to ensure that mother's milk still reaches the baby, because we have spoken enough about how in the past we have spoken enough about how it is a very customized nutrition for a child. So it does not exactly it's not replaceable in any way. Okay, so having said that, for a working mother, what we do is we allow them to start transitioning into the phase wherein they will start pumping, expressing milk and storing it for the baby, so that for the hours that they are away from the child, the expressed breast milk as well as the complementary food meets the child's requirements. So depending on the number of hours the mother is going to be at work, again, it's going to be a very customized approach for that mother based on her working hours, work timings, everything, and the facility at work to be able to express milk and store it and bring it back home for the next day. So based on that, we give them an advice as to how do they manage. But yes, largely the intention is breastfeeding should be continued till the child is 2 years of age minimum. This is the guideline by the World Health Organization, and it is a guideline given in because of the understanding that 2 years constitutes the first 1000 days of life of the child till 2 years. So those are the days when the child's brain development is at its peak, and at that time, if the mother's milk reaches the baby, then it's the most beautiful way to ensure that the brain development takes place the way it should. And also, of course, not just the physical but the emotional and cognitive development of the child is dependent on this mother's milk. So yes, a working mother should continue to provide her own milk, which may not be through direct breastfeeding but through expressed breast milk.
I think the thing about express breast milk and breast pumps being available and being popular, more and more popular these days, it's a blessing for mothers who want to breastfeed but cannot make time for it. So, of course, there is hygiene and processing of the milk involved with that. But yes, it is surely a boon. Um, Our next question is, I think, directed to Dr. Medha, which says, how can new moms best manage sleep deprivation and exhaustion during this postpartum period?
Okay, so this is a very interesting question. I think something we all have had, some challenges in coping with to lesser or greater extent, and this actually links. This question is linked to the talks about postpartum blues as well. So thank you for this question. So there is no uh, you know you know um, um, fixed formula that may be applied to each and every individual, but I will highlight some general rules, okay, which are rules that probably one should apply even outside of this postpartum period. For example, adequate sleep, I'll come to that in a bit, but for now, just mentioning this point, adequate sleep is important because fatigue plays a huge role in the mood swings or how your day goes by or how you interact with other people, so on and so forth. So adequate sleep is important, balanced diet is important, adequate nutrition is important, taking care of bodily discomforts, as in the physical discomforts, they also have a bearing on your mood. They also have you make you feel lethargic, they also make you feel fatigued, and your interpersonal relationship with anybody gets affected, including your own baby, right? And I think, and then the other thing is that to accept the fact that there are certain stages in life when we are more vulnerable than the other stages of our lives, and to be willing to accept help in any form or call for help, you know be it neighbors also, it needn't be your immediate family members, be it anybody whom you can talk to or open up a bit, or neighbors, or anybody in your vicinity who you think is capable of helping, lending a helping hand to you. So I think these are the basic things where things circle around. When I mention adequate sleep, it is easier said than done, because initially, there is no circadian rhythm that the baby follows. Okay, the baby is unable, after birth, unable to distinguish between day and night, and the baby's gut, as in the intestines of the baby, is also getting adapted to this external ways of being fed. Okay, so there is this colicky pain, and after each feed, the gut undergoes certain movements that may lead to discomfort for the baby, and the only way known to the baby to express himself is through crying. And it is difficult to gauge why the baby is crying. You have a sense of helplessness, how to help out the baby, and generally you want to latch the baby all over again. So I think my tips on this, and believe me, I have learned more through my own pregnancies than through my books. Okay, so I'm coming from all these baggage of experiences that I carry, also from the experiences of friends, that try and stick to a rhythm of breastfeeding. Okay, usually if the baby has been fed well, the next feed that usually is desired by the baby is usually 2 to 2.5 hours. There may be times when the baby wants to drink more, but just ensure that the baby is not in discomfort. The reflex reaction should not be that, oh, the baby is crying, I have to feed the baby again. This is very contrary to what you hear all around by some of your family members who are your very well wishers. So but they may not have an understanding, but you are in a privileged position to understand these aspects and then act accordingly in ways that are going to be effective. So feeding rhythm is important. Okay, rooming in with the baby is important, so that you get the cues. Your let down of milk is easy, and you learn to latch the baby well. A good latching is also important, so that the baby gets well fed. So this is about the baby, so that you are able to have a good rhythm of when you want to feed, and understand that a wailing baby doesn't necessarily mean a hungry baby, and from your sleep or from your rested position you just need to get up, spring out of bed and take care of the baby. That's not the case most of the times. And in those situations, when there is help around, seek that help. That somebody can hold your baby, seek that. I will just take one extra minute here to tell you about the night when I delivered my daughter, who is now 10 years old. So in the night here, I delivered her here in Singapore, and at night they took the baby away to the nursery. And when they were taking, I was like, no, it's okay. I can have the baby by my side. And I said that a couple of times until one of the lactation nurses just, firmly told me, Mother, you need to rest. Please rest. We ask you to rest now. Okay, we will bring the baby when the baby needs to be fed. So I was told to rest and I followed that. And oh my God, that rest was so much needed. Only after I woke up from my very, very deep sleep did I realize that I'm happier now and more capable of handling my baby when it comes to me, or feeding the baby, those kind of things. So this is one thing, trying to fall in a rhythm which helps the baby also to understand the difference between days and nights. Okay, and then there should also be, especially Indian moms, there should not be much guilt in, while the baby should be near to you, the baby needn't lie the whole night onto your arm, or you just latch on the breast and then just go off to sleep. That inculcates both bad habits for you as well as the child. So, and from hygiene point of view also, this is not the best perhaps. There have been some unfortunate incidences when baby chokes onto the breast fat. It just covers the baby wrongly, and the nose is blocked, the mouth is blocked, those kind of things. But let's not think about such dire consequences. But even under normal circumstances, it is perfectly okay and should be perfectly guilt free to put the baby in its crib or in its cot, which may be in close proximity to you. But do not try and get into this habit of making the baby latch on overnight. You have to train the baby also gently, while taking care of its nutritional needs and while taking care of yourself. Then going on to what Dr. Pooja mentioned, easily digestible foods, more detox ways of living, good exercise, so that your body is aided in regaining its stamina. Those kind of things are important. The other thing is that you have to understand that fatigue to a large extent is the cause of interplay of hormones. So with time, things settle down. So don't be in a rush and give yourself time. Be patient. I think these would be the mainstays. And when fatigue takes the form of very drastic mood swings that last beyond a couple of months, let's say 4 5 months or even 6 months, which is interfering with your day-to-day life, which is interfering with your interpersonal interactions also, or your bond with the baby, I think that would be probably a time when you would want to consult a trained professional, a psychologist or a psychiatrist. Or if there should be no taboos attached to these things. These are just like our physical ill health. There can be some mental imbalances which need correction through various ways. Okay, and this correction needn't necessarily be drugs. They can just be simple things like sleep hygiene, like maybe some eating habits, maybe some adjustments that you need to make in your lifestyle along with your baby, those kind of things. Okay, I hope that answers the question to an extent.
Yeah. Sure. I think Dr. Medha has set the tone for the next question. But before I move on to that, I think a lot of it is also about, understanding and effectively communicating the postpartum needs to our loved ones around us. Understanding these boundaries and talking about it to the people around us would be very helpful in all of these cases. Uh, Moving on, Ms. Vasundhara, the question for you here is, what are some effective strategies for coping with the postpartum depression and anxiety? So, yeah, here's the big question. But yeah, over to you.
Thank you, Kinshuk. And I think Dr. Medha made my life very simple, because a lot of the interesting strategies that she spoke about are exactly what you should do if you do get a diagnosis. I would just like to add, since she has, given out some very useful strategies in terms of, the sleep, the pattern, and all of that, and also seeking help when you need the help. Of course, finding time for yourself, figuring out whether you need time to exercise, if you're putting on too much weight, and that's making you very conscious. You're getting into body image issues because of the amount of weight. So I put on 23 kilos when I delivered my son, which was not good. Not to say that I was any Aishwarya Rai before that, but yes, the 23 kilos did come in the way of a lot of emotional baggage that I did carry for a while. What I do want to add at this stage is that, we are talking about postpartum blues. Most of us go through that emotional state immediately after we deliver our babies. Could last for 3 to 4 days. For some of us, could last for a couple of weeks. For some of us, typically when you get diagnosed, with a condition, and in this case, like a mood disorder condition, functionality of the individual is getting impacted. So, whatever you are regularly being able to function, if you see that being impacted, if your level of mood swings, if your level of emotional stress, if your level of overall anxiety is going up to such an extent that you're not being able to do your daily chores, if you're not being able to look after your baby well, or do even daily household chores, etc., appropriately, or if you're getting back to work and that's getting impacted, etc., is where you should definitely reach out, first to the family, and then also feel free to reach out to a professional. Of course, one of the strategies that do work is psychotherapy. So if you do get diagnosed, and you do have a professional therapist that you're seeing, your professional therapist will help you arrive at the customized strategies that are going to work for you. So all three of us, between Dr. Pooja, Medha, me, and in fact Kinshuk as well, we can all give you some 2,000 3,000 strategies right up front, right? But what's going to work for you is going to work for you. So that customization in terms of what nutrition pattern, what sleep pattern, what in terms of your coping mechanisms, etc., that needs to be figured out, and for which psychotherapy and going to a counselor or a psychotherapist is going to work. Of course, if your psychotherapist finds that your condition is of a greater severity and you do need medication, both of them can also happen simultaneously. So it's not necessary to have the medication. It is not necessary to stay away from the medication, but it is necessary for you to find the right kind of support. So that is my answer to that question, Kinshuk. And of course, I would like to add that there is a lot of information that is available on the internet. Some good sources, some sources which are which don't have like Medha and I were discussing yesterday, filtered information. And it's important for us to reach out to the correct set of information. So whether you reach out to us and ask us more questions through various modes, or you reach out to the right set of professionals, don't just go Googling and follow the first thing. So just as an experiment, just before we came into this webinar, I just Googled, to say that, okay, what happens when I Google postpartum depression? And to be very honest, the first 10-15 sites that come out don't even talk about the fact that everyone goes through postpartum blues. So everyone's jumping to postpartum depression right up front, and which is my only disclaimer, that Google, yes, find the right kind of information, yes, and then find the right kind of solution for yourself as well. And just recapping what Medha said, your sleep, your patterns, getting your help is always strategies that work. Over to you,
Sure.
Kinshuk.
I think understanding your personalized situation and handling it in a manner that would work for you is very important here. All that we Google is not applicable to each one of us. And only when we really feel that it is going above and beyond to look for a professional help, I think that point is very valid, Vasundhara. I think most of the questions here are addressed within what all of you have spoken. But before we wind up, like I would want all of you to share your 2 cents about how what can be the role of family members, or maybe partners or friends that are around a new mom. So, what can be their role in supporting the new mom's postpartum recovery? And not only the postpartum recovery, I also mean the journey ahead when it, comes down to going back to work, or putting your child to a daycare to find some me time for yourself. So, just a roundup of all of this from all of you. Dr. Pooja, we'll go ahead with you first.
Yes, sure. Yeah, would love to share that what the family can do, because we always talk about this when we counsel in breastfeeding also. So two main things I would say here is, one is you have to build the mother's confidence. Okay, we always say whatever happens, build her confidence. So of course, it's like we said right in the beginning that it's a on the job training. So she was not trained for this. You're not born with a skill of knowing what you're going to do as a mother. So build confidence, meaning whatever she's doing, just keep telling her what you're doing is the best and what you're doing is right. She will find the right way eventually. That's okay, even if she's doing it wrong now. Build her confidence. Okay, so that's one very, very important thing for every family member. Don't increase her fears by saying, oh, I think this is going wrong. Oh, I think milk is not enough. Oh, I think you are eating this. Just say whatever you're doing is right, just, and then you'll see there'll be a beautiful change in how she deals with everything. And secondly is, of course, having listening skills. So just with empathy, you just listen, be an empathetic listener. Just don't think you have to give advice. She will find her own way. Okay, so she will find a solution, because like all of us are saying here, it comes from within, because it's you, it's everyone is so different. So it'll come from within, but just be an empathetic listener and hear her out. That's it. So I think it will be from me. Build confidence and listen.
Sure. Vasundhara, would like to hear from you too.
I love the empathetic listening piece, because I think that's
Yeah.
so critically important in life in general. So of course the mother needs it the most. For me, I think, to add to what Dr. Pooja is saying, uh, as a mother, can I accept the fact that there are people around, and I can reach out to hand over my baby, trust someone else with my baby? Of course you will be the best at it, you are best at your job, but once in a while, just trusting someone else with your baby, keeping a keen eye on what's happening to your baby, right? But I think just splitting that sense of responsibility. And typically also, what we don't realize is that while we talk about postpartum for mothers, men can go through it as well. It's a role change for your husbands, it's a role change for everyone in the family. So just being there for each other through that identity shift is important as well. So your spouse could be equally irritable because they are feeling helpless, they don't know how to help you. So you being able to communicate better is going to be better for both of you. So I'm going to say that, be able to communicate. Don't feel afraid of saying the wrong things. I think I'm an NLP practitioner, and we always believe that whatever decision you take at that point in time in your life is always using the best resources you have at that point in time. So a decision can never be incorrect, and as far as your baby is concerned, it can never be incorrect. So just communicate with each other, be partners in that process, and the journey will be beautiful.
Great. Dr. Medha, what do you have to say about this?
So many beautiful things have been told by Pooja and Vasundhara, and this is such a nice forum to have a heart-to-heart talk. Actually, it feels heart-to-heart communication. Where were you guys when I was going through my pregnancy? I just feel like saying that. So, just to build up on what has been shared by Pooja and Vasundhara, additionally, I would say that to understand pregnancy and post-delivery aspects or transition the body undergoes, this can be pre-learned. Okay, this through authentic resources. One cannot simulate the experience, but you can learn the facts. Okay, so that you are your partner or your family members probably just not their responsibility is that apart from being there, they need to be there effectively. Okay, so they will be effective if they are, if there is awareness and to an extent education. Okay, I'm not asking people to go through a whole syllabus of things and read chapters over chapters, but some authentic sources, some effort to know what would be the transition and how you can be effective. So this is one thing which includes your partners as well. Me and my spouse, we both are doctors, but uh, we needed dedicated reading about certain topics to understand those topics better. We don't consider ourselves experts at bringing up or nurturing a child, or taking care of my own self post pregnancy or during pregnancy. We had to build up on our knowledge base, and that helped us keep a logical self to ourselves. That is one thing I would like to say. The other thing is that um, a- uh, sometimes some logistical planning is needed. For example, I'll give you an example. I had my backache used to get aggravated trying to change my baby's diaper day in and day out, bending down, changing, and all those stuff. um, and then with a simple logistical change, things got so sorted. So my mother-in-law helped me arrange a diaper setup, like a table, with a diaper bag, with diapers organized, with the whatever diaper cream there, with antiseptic wipes and all those kind of things, sanitizer, etc., etc. Whatever you would need handy. So that table was there at a very good place. There was a tray table kind of a thing where the baby can lie down safely, and I don't have to bend. So that simple thing made my life from hell to heaven, really. My backache really, really improved after we did that small change. So this kind of logical planning is needed, okay? So be aware of that and get the right things. They are all worth it, okay? The third thing that I want to add is that while motherhood goes on, the rest of the life also goes on. You don't stop being an individual with your own interests, which you previously had prior to motherhood. So you should take time off to indulge in your other interests. Like, for example, some people may like cooking, or you want to do crochet, or you want to try your hand out at an art piece, or you just want to listen songs or watch a movie or a series on Netflix. Go ahead and do it at the relevant times, with when you have adequate support. And so should the family members be promoting, like a constant talk about motherhood, about how to take care of baby, how to beyond this life should go on. So these are my insights.
I think I echo with all of what you have said. And this discussion today, of course, has taken all of us back to our early motherhood days. And yeah, I think it has been equally fruitful for our audience today, who are in this state today and are looking for expert advice from different places. I hope all of your questions, a lot of your questions rather, would have been answered. So, thank you for joining us today for this very important conversation. And we hope that you have gained valuable insights and practical tips for supporting your physical, emotional, and mental well being during this transformative period in your life. A very, very, very uh, thank you from a big thank you from my heart for all the panelists today who have taken out time to share their thoughts and personal journeys also with us here, because this has been very enriching for me, and I understand it will be the same for our audience. So just one line before I wind up, that please remember to prioritize self care, seek support whenever needed, and celebrate the joys and the challenges of motherhood, because this is a time that will not return back once your child grows up. So, thank you for tuning in once again. Have a great day. Thank you.
Thank you so much.